Hi, my name is Brad Nelson. I'm one of the certified podorthists at the Foot Lab. In this video blog, we're going to talk about plantar fasciitis. So first of all, what is it? In this little plastic model of a foot, the plantar fascia is the ligament that attaches the forefoot back to the heel. So plantar fasciitis is the inflammation of this ligament, particularly back at the heel. And actually what's causing the pain that most people feel is that the ligament is being pulled away from the heel in the back here, and there's actually forming small little micro tears. And it's those micro tears that create the pain associated with plantar fasciitis. To understand what causes plantar fasciitis, we need to look at the three basic postures or alignments of the resting foot. These postures are supination. These are people that load the outside of their foot. They have a high instep and a high arch, kind of a rigid foot. The second posture is the neutral foot, or the perfect foot. And then the third posture would be a pronated foot. Pronated foot is the normal foot and represents about 80% of the population. When the foot pronates, it goes through a number of changes. And the most significant one is that as it pronates, it gets longer. And it's this lengthening process that stretches the fascia, makes those micro tears back at the heel, which is what causes all that pain. Another thing that causes plantar fasciitis is an excessively tight calf muscle. On this little plastic model here, a number of the calf muscles come down into the Achilles tendon, and as that is being pulled up in this direction, it tips the heel back this way, which puts this excessive tension back on the plantar fascial ligament, and that again causes the pain. The first step to deal with plantar fasciitis is to stop the micro tears from happening. So to do that, we use a tape therapy. This tape therapy goes around a non-stretching fabric with an adhesive backing. The tape wraps around the forefoot and back of the heel, and it holds the foot in compression, which takes the tension off the plantar fascial ligament and allows the micro tears to heal. Now, one thing about the tape therapy is you put this tape onto the foot, leave it on for 3 to 5 days, and you go through 15 applications of that tape. So the important thing to remember is once you change the tape, you can't take a single step on that foot without putting the new tape on. Stepping down on the foot again is going to re-tear the micro tears and lead us back right to square one. So now that we have the tape therapy going, the next thing to do is to figure out how to prevent plantar fasciitis from reoccurring. So the way we do that is by building an orthotic. The orthotic starts out as a blank. The blank is made up of a sandwich of different materials. One of the materials inside this sandwich is a rigid plate. The rigid plate goes into an oven. When this comes out of the oven, this is the consistency of a cooked noodle, so it's really moldable and malleable. We stand you on molding pillows. We hold the foot in that perfect neutral posture. And when we're done, we end up with an orthotic that's perfectly shaped like your foot in neutral. The next step is to take cork material, attach it to the bottom of the orthotic blank, grind it so it fits inside the shoe. So now when you're putting your foot into your shoe, you're putting your foot into a perfect mold of your foot that will hold the foot in neutral posture. One of the things to remember about orthotics is orthotics are to feet like glasses are to eyes. They don't cure anything, they only correct the posture. And they're only going to work as long as you're wearing them. So over the course of an entire day, if you have plantar fasciitis, we like to say that you need to be on these orthotics about 80% of the day. So when you come to have your orthotics made, bring us the shoes that you're going to be wearing so that we can try and fit this to as many different shoes as possible. Then it's easy to just move it from one shoe to the next. To make an appointment at the Foot Lab, go to our website, thefootlab.com, click on Make an Appointment, and follow it through to either myself or one of the other podorthists in the Foot Lab. When you come, be sure to bring the shoes that you're going to want to put the orthotic into. The actual Fabricating of the orthotic takes us about half an hour, so bring a book or something to do while you're waiting. We have coffee and water and whatnot. And the entire process is going to take about an hour. So we'll get you in, get the orthotic made, and then a big part of building the orthotic is getting the orthotic into the shoe and then letting you walk on our treadmill so we can make sure that we've got the correction we're looking for. So we should have you out of here in about an hour. Sometimes you might need a little bit of an adjustment, but usually not. Thanks for watching our video blog at the Foot Lab, and take care of your feet.